Clinical depression signs and symptoms. Clinical depression, also known as major depressive disorder (MDD), is a serious mental health condition characterized by persistent and pervasive feelings of sadness, hopelessness, and a loss of interest or pleasure in most activities. It can significantly impact daily functioning and quality of life. Recognizing the signs and symptoms of clinical depression is crucial for early intervention and treatment. Here are the key signs and symptoms. Persistent sadness. Individuals with clinical depression often experience persistent feelings of sadness, emptiness, or unhappiness. This emotional state may last for most of the day, nearly every day for at least 2 weeks or longer. Loss of interest or pleasure. A hallmark symptom of depression is the inability to find joy or interest in activities that were once enjoyable. Hobbies, social interactions, and even basic self-care activities can become burdensome. Fatigue and low energy. Depression often leads to extreme fatigue and a profound lack of energy. Simple tasks may feel overwhelming, and individuals may struggle to get out of bed in the morning. Changes in sleep patterns. Sleep disturbances are common in depression. This can manifest as either insomnia, difficulty falling asleep or staying asleep, or hypersomnia, excessive daytime sleepiness, and long hours of sleep. Appetite and weight changes. Some people with depression may experience changes in appetite, leading to weight gain or loss. Overeating or a loss of interest in food can both occur. Feelings of worthlessness or guilt. Depressed individuals often harbor strong feelings of worthlessness, excessive guilt, or self-blame, even in situations where they are not at fault. Difficulty concentrating. Depression can impair cognitive function, making it hard to concentrate, make decisions, or remember details. Physical symptoms. Depression can manifest with physical symptoms such as headaches, digestive issues, and chronic pain, which may not respond well to medical treatment. Irritability and restlessness. While sadness is a prominent feature, some individuals with depression may also become irritable, agitated, or anxious. Suicidal thoughts or behaviors. In severe cases, depression may lead to thoughts of suicide or self-harm. If you or someone you know is experiencing these thoughts, seek immediate help from a mental health professional or a crisis hotline. How clinical depression is diagnosed. Diagnosing clinical depression, also known as major depressive disorder (MDD), is a complex process that requires a careful evaluation by a trained mental health professional. It involves a combination of clinical interviews, assessment tools, and medical evaluations to establish a clear diagnosis. Here's a step-by-step breakdown of how clinical depression is diagnosed. Initial assessment. The diagnostic process often begins with an initial assessment by a healthcare provider or mental health professional, which can include a primary care physician, psychiatrist, psychologist, or licensed clinical social worker. This assessment serves as the first step in identifying potential symptoms of depression. Clinical interview. The core of the diagnostic process is the clinical interview. During this face-to-face or virtual conversation, the mental health professional engages with the individuals to gather detailed information about their emotional and mental state. Key elements of the clinical interview include symptom evaluation. The mental health professional asks about specific symptoms, including the duration, frequency, and severity of depressive symptoms. Questions may address mood, interest in activities, changes in appetite and sleep, energy levels, and thoughts of self-harm or suicide. Medical history. The individual's medical history is discussed to identify any underlying medical conditions, medications, or family history of mental health disorders that may contribute to or mimic depressive symptoms. Psychological history. Questions about life events, stressors, traumatic experiences, and recent changes in the individual's life are explored to understand potential triggers or contributing factors. Assessment tools. To supplement the clinical interview, mental health professionals often use standardized assessment tools and questionnaires to evaluate the presence and severity of depressive symptoms. The most commonly used tool is the Diagnostic and Statistical Manual of Mental Disorders, DSM-5 criteria. According to DSM-5, a diagnosis of clinical depression requires the presence of specific symptoms over a defined period. Physical examination. In some cases, a physical examination may be conducted to rule out medical conditions that can mimic or exacerbate depressive symptoms. This may include assessing vital signs, neurological function, and conducting blood tests to check for conditions like thyroid disorders or anemia. Psychological testing. Psychological tests and questionnaires may be administered to assess the individual's emotional state, cognitive functioning, and personality traits. These tests can help provide a more comprehensive understanding of the individual's mental health. Duration and impairment. Diagnosis also considers the duration and impact of symptoms according to the DSM-5 criteria. For a diagnosis of clinical depression to be made, the individual must experience a depressed mood or loss of interest or pleasure in activities for most of the day, nearly every day, for at least 2 weeks. Additionally, the symptoms must significantly impair daily functioning and quality of life. Rule out other conditions. Part of the diagnostic process involves ruling out other mental health conditions that may share similar symptoms with depression. These conditions may include bipolar disorder, generalized anxiety disorder, or other mood disorders. Collateral information. Collateral information from family members, close friends, or other caregivers may be considered to gain a broader perspective on the individual's symptoms and behavior. Follow-up assessments in clinical depression. Follow-up assessments play a vital role in the management of clinical depression, major depressive disorder, or MDD. Once an individual has been diagnosed with depression and has initiated treatment, follow-up assessments are scheduled at regular intervals to monitor progress, adjust treatment plans, and ensure that the individual is on the path of recovery. These assessments are essential for providing ongoing support and improving the overall mental health and well-being of the person with depression. Here's a detailed look at follow-up assessments in clinical depression. Purpose of follow-up assessments. Assessing treatment efficacy. The primary purpose of follow-up assessments is to evaluate the effectiveness of the chosen treatment or treatments. This includes assessing whether the prescribed medication, psychotherapy, or combination of both is helping to alleviate depressive symptoms. Monitoring symptom progress. Follow-up assessments track changes in the severity and frequency of the depressive symptoms over time. This allows healthcare providers to determine whether symptoms are improving, worsening, or remaining stable. Identifying side effects. For individuals receiving medication as part of their treatment, follow-up assessments help identify any side effects or adverse reactions to the medication. This information guides treatment adjustments or changes. Adjusting treatment plans. Based on the assessment results, healthcare providers can make necessary adjustments to treatment plans. This may involve changing medication doses, switching to a different medication, or modifying the psychotherapy approach. Preventing relapse. Follow-up assessments help identify early signs of symptom recurrence or relapse. Prompt intervention can prevent a full-blown relapse and maintain stability. Providing support. These assessments also provide an opportunity for individuals to discuss their experiences, express concerns, and receive emotional support from their healthcare provider. It's a safe space to address any challenges they may be facing. Frequency of follow-up assessments. The frequency of follow-up assessments can vary depending on individual needs and treatment plans. Common intervals include weekly, bi-weekly, monthly, or every few months, depending on the severity of depression, treatment response, and clinical judgment. In the initial phase of treatment, more frequent follow-up assessments may be scheduled to closely monitor progress and make necessary adjustments. As symptoms stabilize and improve, the frequency of follow-up assessments may be reduced. What happens during follow-up assessment? The assessment typically begins with a clinical interview similar to the initial evaluation. The individual discusses their current emotional state, any changes in symptoms, and their overall well-being. Healthcare providers may use standardized assessment tools to quantify and evaluate depressive symptoms. These tools help track changes over time. Medication management involves reviewing the effectiveness of prescribed medications, discussing any side effects or concerns, and making appropriate adjustments. Psychotherapy progress is discussed during follow-up assessments, including insights gained, coping strategies developed, and challenges faced during therapy sessions. The individual's overall mental health and any changes in life circumstances are considered, and these factors can impact depression symptoms. Collaborative decision making. Follow-up assessments are collaborative, involving the individual with depression and their healthcare provider. Treatment decisions are made jointly, taking into account the individual's preferences and goals. The individual is encouraged to ask questions, express concerns, and actively participate in decisions related to their treatment plan. Documentation and treatment records. Follow-up assessments are documented in the individual's medical or treatment records. This documentation helps maintain a comprehensive history of treatment, progress, and informs future care. Support and encouragement. Beyond assessing treatment outcomes, follow-up assessments provide emotional support and encouragement. They offer individuals with depression an opportunity to discuss their experiences, share their challenges, and receive validation and guidance from their healthcare provider. Multidisciplinary evaluation. In complex cases, a multidisciplinary team of healthcare professionals, including psychiatrists, psychologists, and therapists, may collaborate to ensure accurate diagnosis and comprehensive treatment planning. In conclusion, the diagnosis of clinical depression involves a systematic and comprehensive evaluation of an individual's symptoms, history, and overall mental health. It's essential for the assessment to be conducted by a qualified mental health professional who can accurately diagnose depression, differentiate it from other conditions, and develop a personalized treatment plan tailored to the individual's needs. Early diagnosis and intervention are crucial for effective management and improved well-being in individuals with clinical depression.